Welcome to the Real Integrative Medicine Podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in.
Did you know that there's like 3 different kinds of patients, and regardless of what health condition you are struggling with, how you fall into each of these 3 categories is probably going to change the way that you approach your healthcare. It's probably going to change what you decide to do for treatment. And, which we'll get to in a second, I think there's actually quite a bit to learn from the people that are in the other camps or other categories. And today I'm going to ask you to sort of stretch your mind in terms of thinking about the way you typically think about your health and health journey, and maybe borrow from some of your friends and peers and family members the way that they think about their health journey to be to your advantage. So when we talk to clinicians about evidence, right, you know, my absolute mission is to bring evidence-based naturopathic medicine to the forefront, to the masses. I want to equip your practitioner with the care guidelines on how to practice naturopathic medicine for every primary care health condition. And we are tackling that with the Confident Clinician. But when we start to talk about, you know, the way that people think about healthcare decisions and health decisions and evidence, there are 3 very distinct populations of people. And whether or not you fall in either of these categories is going to make you act a certain way when you're faced with your own healthcare decisions. So what we're going to do in this episode today is talk about sort of these 3 categories of people. You're probably going to self-identify with one, or maybe you're in one category for like your dominant health issues, and then you're in another category for others, or you've like flirted with one of the other categories. And then we're going to talk about the pros and cons of being in each of those categories and what we can learn from the way that people attack their health goals, for you to maybe try on some of the pros of thinking about health a little bit differently. So we have our health hobbyists, right? We all know them. You might be one. You're listening to a podcast on health. We have health hobbyists, okay? The people who are health hobbyists enjoy the process of trying to get healthier. It's part of their weekly plan to do activities that are going to make them healthier, are always consuming new information about what could potentially make them healthier. They are trying to, you know, sort of out hack or out strategize aging in a lot of ways, and maybe are more likely to experiment a little bit or try different solutions for their health in the pursuit of greatness. Okay. Our health hobbyists are the people who will take an anti-aging supplement, or they will see a new kind of practitioner, or they want a particular kind of test, even if the research has not really caught up to that being standard care. They're like, it's okay. This is fun for me, right? This is fun for me. I'm going to do this anyways. Yes, I'd like to improve my 5K time by 27 seconds, right? The people that are really on this mission to live their best health life possible, and they're willing to do things in order to achieve that. And they find the whole thing actually kind of fun. I used to love working with health hobbyists on one hand. I'll talk about the other hand in a second. But health hobbyists were fun because they did their own reading. They would come with ideas. They were kind of gamers, right? So if you would say, well, you know, the research on this is a little emerging, or the link between this and this is, you know, kind of novel, they were like, all in. They would go home, they would listen to podcasts about the topic, they would take their supplements, they would try new exercise, they would download the meditation app, right? Like they were really super bought in and had carved out parts of their day and week and month and year that was exclusively about their pursuit of health. And that's fun, right? Especially as a practitioner, because it's like these people have already said, this is a value of mine, right? You don't have to convince me of anything. I'm already here. You just get to like jog along beside me while I pursue this, awesome, cool stuff with respect to my health. Love health hobbyists. We'll talk about the cons in a second. Our next category are sort of, I call like Gen Pop, right? Like the general population of people where their health is not a hobby. It's maybe not in their face all the time in terms of like their calendar, but they may still have symptoms, right? Like it's not that Gen Pop people are not having health and health challenges. It's where their priority lies with respect to the pursuit of greatness in their health that maybe is a little bit different. People in that Gen Pop category are doing what, the public health recommendations, or they're maybe in the pursuit of public health recommendations. They do their regular physical, they do what they're told with respect to health. Maybe that's the best way to put it. They do what they're told with respect to health. And their pursuit of health is really around preventing disease, right? And I would say the risk here for this group, which we'll talk about in a second, is mediocrity, right? Like the risk for being in sort of like the general population and feeling about your health the same way that the general population does is that you risk mediocrity in your health. Sure, it's not taking up like massive hours or percentage of your day, but you also just feel fine, right? You just are fine. You maybe have some aches and pains. You maybe have some signs of aging. You maybe have some things creeping into your life. But it's not important enough actually for you to pursue it with a vengeance. And you're really not in the pursuit of like trying to feel invincible with respect to your health. You're really just trying to like be fine. And people that are in Gen Pop, they care about evidence. They want to do evidence-based practices. They're curious about the standard of care. Like I said, we kind of just do what we're told when we're in that Gen Pop. Most people live here, right? Like most people live in this category where you're doing things, you're doing health. Maybe you aren't even listening to this podcast. I don't know. But your health is not your hobby. Your health is just a thing, right? And your health is fine and it allows you to go about your day, but you really are not pursuing it with a vengeance and maybe don't enjoy it, right? I think people who live in this category know they should exercise and sometimes do, right? They know they should eat well and sometimes buy broccolini, right? You know and you try, but it's not your passion, it's not your hobby. It's certainly not taking up a lot of time in your life, and you're really doing what you're told. And when we practice evidence-based medicine and evidence-based standard of care, there's lots of like awesomeness about that from a public health perspective. So if you're in the general health pop, if you're in the Gen Pop group and you are following the standards of care and you are following the Canada's Food Guide, you'll do great, right? On average, you'll do better than people who don't do that. That's why those are the standards. But we also run the risk, especially the way that our care guidelines are built, is that if you're unique and you have something curious going on with your health, you might get missed, right? Because the way we treat Gen Pop conventionally is very en masse. Most people should do this. Most people benefit from this. And if you are the 1 in 100 that don't, you may not get what you need out of being in that general population category. And so it's possible that you are not feeling as well as you could. But generally, if you follow the recommendations and guidelines, you prevent disease. Now, do you like spring out of bed like 110% and you can't wait to take on the day? Probably not, right? Like the general population is just trying not to be sick. And the standard of care guidelines are also trying to help you not to be sick. They are not written for the health hobbyist, which is why it's another category. They're written so that the vast majority of people don't cost healthcare anything, and the vast majority of people don't die today, right? Like that's literally what we're hoping to do, is like, let's not die today. But Gen Pop, the evidence really matters. The problem is that the nuance in the way that we think about health for general population means that we miss lots of people, and it also has a different target. It has a different outcome, a different target than other groups, right? When we look at the research and evidence on how we help patients with autoimmune disease or how we help patients with cholesterol, our target is just to lower numbers, or our target is to help you not go to the hospital. The target for you might be that you want to thrive, but if you follow sort of that Gen Pop health status quo, it's very hard to thrive in that category, truthfully. But many of people are in there, right? Many of you may be in there. And then the third category of people are the people who are at the like out of luck, right? Like out of options, right? Like I call this the like shit out of luck category. And what's so interesting here is we'll notice when people get to the end of the road, right? Maybe, and I don't mean death, but I mean, it's possible. I mean, like you've exercised all of the available options to you, or you have got to a point where people, your healthcare practitioners kind of throw up their hands and say, well, there's nothing we can do. Or you've tried all of the, Gen Pop options, and now you are still suffering, but it feels like there's no other options. And then the other people that will like fall in this category are people who have been given a life-limiting diagnosis, or a really significant diagnosis that is the proverbial wake-up call in terms of what's going on with their health, right? You might be cruising through your 40s and suddenly get diagnosed with high cholesterol, and now you're like, oh my gosh, living this status quo is no longer okay. And it dramatically helps you do a 180 with respect to your health. And the people that are over here in this like run out of options, hit a brick wall kind of experience with their health, they actually approach their healthcare very differently as well. Interestingly, we often like care very little about evidence when we get there, right? And I used to do lots of cancer care in my practice. And it was interesting that like as our options became more and more limited, the more we were willing to be creative and experiment a little bit with solutions, because we were running out of options and we were running out of time. That sometimes can happen to people when they feel like they've exercised all their options, right? If you've done everything there is to do for your migraines, as far as you're aware, your interest in doing other random things or something you read about in a magazine might actually pique your interest, even if it's not, that validated. And it's because you feel like backed into a corner with your health. When you're backed into a corner and the pressure is on, I would say like pressure creates dust or diamonds. When people are backed into a corner with their health, they do amazing things, right? And maybe you've had this experience yourself. Maybe you've had this experience in your family members. But if you ever watch someone get backed into a corner with their health, they quit alcohol, they start exercising, they eat better, they finally discover protein powder, right? When we get backed into a corner, we suddenly have a massive impetus to change. And we also, unfortunately, care less about evidence, which is I'm going to talk about why that's a problem in a second. But unfortunately, we start to care less about evidence. If people feel like they've tried everything, then all of a sudden they're willing to like stand on their head and smell a certain oil and, rub a particular cream on the bottom of their feet, all in, the name of a health, when they had to get backed into a corner in order to feel that way about their health, right? And there are probably other options for them. But their behavior is something that I think that maybe we want to borrow, right? Some behaviors and commitment to change is something that I think Gen Pop could probably learn from. So I'm curious which category you think you fall in, right? Those, like I said, those health hobbyists can be so fun to work with. Gen Pop can be hard because We have evidence for how we can make you more than fine in your health. The problem is if your health is not of interest to you, or if you don't have a couple hours a week to spend on your health, that made my job a heck of a lot harder, right? People would come, like they had like their curiosity had been piqued about seeing an ND. How can I improve my bloating by seeing an ND? And then when we started to talk through some of the options, they're like, this sounds like cooking, right? Like, this sounds like cooking and exercising. And you know what? My bloating actually is not that bad, right? That's how the conversation would often go. It's that the Gen Pop doesn't value or prioritize their health as part of their day-to-day activities. And so in order for us to get them from fine to awesome, we needed them to commit to being a little bit of a health hobbyist, right? We needed them to put their health on their calendar. Gen Pop also has been generally educated that the solution to their problems should be a pill, right? And I think deep down we know that that's not true. We just like secretly still hope that it's true. And lots of the way we deliver medicine in conventional care still operates that way. So if there's a pill over here for your acne, we'll say for an example, and over here we need you to try on some like behavior strategies or what have you. If you are in that Gen Pop, you are always going to gravitate towards the simpler, faster solution, maybe not the more robust solution that improves your total health and well-being and your symptoms, right? And so the reason I wanted to talk about this and that I think is so valuable, because one, it helps really contextualize for you how to approach your healthcare appointments, right? I think sometimes we want to try on, or we think about ourselves as one of the other categories, like the health hobbyist, and we start to pursue solutions that require that level of commitment. And then we're like severely disappointed by the results, but we didn't actually do it. Like, this is important, right? If you are in that general population, your options may be limited if you don't want to create space in your week to have health be part of your interest and hobby, right? If you want to, I'm going to say in air quotes, like do the thing naturally, you are saying that you're going to make this a little bit of a project for yourself and be a bit of a hobbyist. You can't say you want to lower your cholesterol naturally, but you'd like to also go along your merry way. Those two things can't go together, because if your cholesterol was going to be lower by you doing what you're already doing, then it wouldn't be high, right? It would already be low. And so moving over into that health hobbyist land is where we often need Gen Pop to jump over to in order for them to achieve their goals of doing things naturally. I'll say in air quotes. We can learn a lot from those health hobbyists, right? Like, they actually are enjoying the pursuit of their health, right? They're enjoying the pursuit of their health. And if we could recruit Gen Pops to feel that way and be like, yeah, actually, you know what? I actually kind of like this Pilates thing. Or I'm going to figure out 3 new ways to cook this broccolini that's, going rotten in my fridge. If we could pull people over into creating space and time and interest in their health, we could raise the bar in terms of how they feel. We could stop having mediocrity be the outcome, right? Like, this is the outcome of general population healthcare, is not to go to the hospital. If you want for more than that, then the project has to include some kind of effort level for you to actually be able to achieve that kind of result, right? So the Gen Pops can learn quite a bit from the health hobbyists.
I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence-based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision-making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us.
We also can learn a lot from the people who are backed into a corner, right? Like if, and there's all those quotes that float around and sometimes they resonate with me, right? It's like if if you were like on death's doorstep at 87 and someone said, okay, I'm going to transport you back, Jordan, till you're 43, how would you live your life differently, right? If you knew when the end was, if you knew this was your last summer, if you knew this was the last time you were going to be able-bodied, right? If you knew this was the last year you were capable of hiking, where would you want to hike, right? We're not very good at that, right? Like we always just kind of imagine that everything's going to be fine forever. But the Gen Pop can actually learn a lot from the people who've been backed into the corner, because if you were proverbially backed into a corner, how would you behave? Would your calendar look the same way, where we don't see health, wellness, like mindset? We don't see any of that anywhere in your life or calendar. If you knew that this was the last year for you to pursue certain aspects of your health to achieve, 10 extra years in your life, would you behave differently? Like you probably would buy some new running shoes. So the people that have run out of options should inspire, the rest of us that they're amazing. They're capable of amazing feats, right? I've watched people backed into a corner with their health transform themselves. And I'm not saying that they went from death's doorstep to thriving necessarily, but what they were able to do with behavior is inspiring. What they were able to do with their calendar was inspiring, right? And I think, if we did the hypothetical, if something happened to someone in your family right now, you would clear the deck, right? You would get rid of stuff that doesn't need to be there. You would order groceries instead of going to the grocery store. You would create time and space for it. You don't have that pressure. So if pressure creates diamonds and now we have zero pressure on your health as a Gen Pop, who's just walking around like in mediocre land, there's no pressure for you to change. The people that are backed into a corner have no other choice, and they do it. They exercise more than you. They eat better than you, right? And I'm not saying that in a judgy way. I'm saying that they have found a way to make it happen for themselves because the pressure created the diamond. So I think it's really important as a general pop person to look at those two other poles and say, okay, I got my health hobbyists like Pilates fanatics over here who can't stop talking about what they put in their smoothie. Can I learn something from them? Actually, you know what? They totally are enjoying this. They totally love taking care of themselves. And that is so aspirational. I wish that everyone in the general population was excited to take care of their body as the health hacker was. For right or wrong, right? Maybe the things they're doing I don't agree with, but their passion in the way they pursue it. I mean, I'd like to hang out there where I'm so jazzed to take care of myself every single day like that. I think we can learn a lot from that. Their interest in their health is admirable. Then when we look at the other side and we see people who are backed into a corner, the things they have become capable of because of the pressures put on them is also aspirational. But when we're walking around in the middle, right, and mediocrity is the goal of health care, and you do feel mediocre, you don't enjoy taking care of yourself, and you don't have enough pressure to actually change. And that is a dangerous place to be, right? That is a dangerous place to be because your health is happening, right? You are aging, which, whatever, we are aging. The things are happening, right? Like there are things that are happening even if they are not showing up in your health today. But looking at those two poles of those other groups of people, I think we can see reason to maybe borrow some of their behaviors actually for you to achieve the health goals that you want. You need to enjoy it, and you also need to create that pressure for yourself that you have to do it. Otherwise, we'll just live in mediocre land forever. So what are the cons of the health hobbyist? I think the health hobbyists sometimes can learn something from Gen Pop. Okay. So one of the challenges of being in that health hobbyist camp, and if you are this person, listen up, is that they are doing so many things for their health that they have these almost like a diminishing return on their health and health care. We often will see that people in this camp are avoiding fun. Right? They find it fun to take care of themselves, but they like would die having to go to Canada's Wonderland because what are they going to eat? Right? Like they are avoiding certain things in that create joy and create life and create connection because they're trying to pursue health to the at 110% all the time. So quite often are avoiding regular human experiences because of the food or because they don't want to stay up late or whatever it is. And I've definitely worked with people that are like, no, my bedtime is 9:15. That's what gives me the best recovery. And I'm like, yeah, but the concert, what about the concert? And still, despite me writing in every comment box at every concert I've ever gone to, they're not moving it to 4:00, right? You have to stay up late if you want to go to the concert. So if your health hobbyist pursuit actually is creating so much structure that you don't get to live, I would say you have a thing or two to learn from the Gen Pops who will wake up the next morning just a touch tired and maybe a little bit dehydrated and a sore throat from singing, but they went, right? And they had the experience and the life and the connection that you were avoiding, right? By being so healthy all the time. The other thing that health hobbyists often are doing is doing so many things that there are lots of things that they're doing that have no return on them. And that increase in pill count or in activities maybe could be put towards other things or other aspects of your life or budget that is because you're not getting a return from so many of those things. Do you need to take 9 antioxidant supplements and you eat blueberries and eat quite well all the time? No, right? The Gen Pop public health guidelines are built for that sort of bare ass minimum. And I'm not saying that you should do that because that's not your goal as a health hobbyist, but we have to be curious if we are recommending baseline, 3 things for this health condition and you're doing 19. Could you get away with 15, right? Like I think as a health hobbyist, sometimes it's helpful to have someone almost sponsor your health journey to make sure that the things that you're doing are valuable and that it's not part of it's not so addicting in terms of a hobby that you now have added lots of things that you don't need, right? Sometimes it's helpful to have a person to be like, you don't need that. Stop it. So that's sort of the cons of the health hobbyists. The challenge with the other group, the backed into a corner group, is that they often will care so little about evidence that they miss doing things that are evidence-based for their condition, right? So I saw this a lot when I did, worked in cancer care, where I would have patients come in, they were so blindsided by their diagnosis and they wanted to do everything they could. And so we started to do that. And then they would come in 2 weeks later and they were taking a veterinary medicine that they'd bought off label from Amazon and had shipped to a PO box in the US so that they could drive across the border and get it and start taking it because someone on the internet said it was a good idea. There were lots of things we could do for that situation, right? There was that person, and I'm thinking of one person in particular, but this is like a theme. There were lots of things that we could do that were actually quite evidence-based for this person. But as they felt more scared and as they felt more backed into a corner, their interest in conventional evidence and conventional practices started to disintegrate because they were so blindsided that they were even here in the first place. Right? Oh my gosh, well, if medicine worked, then why am I here? Right? If healthcare works, then why is my blood pressure going up? And that seed of doubt actually starts to create an interest in very off-label and unevidence-based solutions, right? And if you feel backed into a corner and you're going to throw the kitchen sink at it, then you start to become way less discerning about what you're doing, actually. And you don't have to do that, right? There are many, many, many ways to support people who are feeling backed into a corner with their health, or they have tried everything. I guarantee you, You have not tried everything. I guarantee you that there is evidence for something that has not been brought up to you as of late, right? Especially if you previously lived in Gen Pop and you're going about your mediocre, merry way with your health, and now you're faced with a diagnosis that is unresponsive, or you've tried all the painkillers and you still have migraines. There is a solution that does not require you using like dog medicine, right? There is a solution out there. And that's where the guidance of a practitioner can be quite helpful, because they can help you discern whether or not the things that you're thinking of doing are valid. And they also can help you look at your health from a different angle, maybe a unique perspective, and get you out of that feeling that you're in sort of the Gen Pop cycle of care where, there's nothing else we can do. We've tried all the options. Sorry about your luck. You don't have to feel that way. There are other solutions and other ways of looking at health, especially if you live in like a highly regulated public health region, or, in Canada, where we have like most healthcare is delivered through government funded situations. And I've said this to family members, and I've said this to patients. We always have to ask the question, is this the best option, or is this the option that I'm being shown? Because when your healthcare is being publicly funded and the drugs are covered, you're getting shown the option that is available based on where you live geographically, but that doesn't mean that's the best option. It doesn't mean it's the only option, right? Even if we look at birth control, like if I was going to go on birth control, I'd like to live in the UK. They have way better birth control options than we have in Canada. We have, as a developed nation, we have like the least choice on birth control. And now we're going to give it away in lots of provinces for free, which is amazing, but we're giving away a sucky choice for some people. And it actually makes you feel like you don't have any other options, when the option that you're being given is because of where you live geographically, not because it's the best, right? Lots of countries make birth control, and they make way better ones in the UK. Anyways, the people that have run out of options can make that mistake, right? Where they throw the kitchen sink and then suddenly they're taking like like I said, a veterinary medicine that they bought on Amazon. I'm not joking. And this has happened more than 5 times in my career, literally. So we need to care just as much about evidence. And if we're going to walk off the beaten path and maybe do something that's a little less evidence-based, there needs to be a decision-making framework here for it. So why are we doing it? What are our expected outcomes? And hopefully it's not replacing something that we do know works, right? Because it's fine if it's like the 19th pill you're taking, but don't get rid of evidence-based solutions for your kitchen sink approach in favor of something that you bought online. And then my big call to the Gen Pops is that we're not here for mediocre, or at least I'm not, right? I'm not here to be mediocre. I think that thriving is the choice, right? Thriving is the decision or the choice. The challenge is that you do have to try on some of the feelings and behaviors of people that are experiencing health and healthcare differently than you are. You have to like it, right? You have to kind of like it. Otherwise, like, no habit that we don't like is sustainable. You have to kind of like it. You also have to have some pressure. You have to feel like it's important, because if you don't like it and you don't feel like it's important, and today you're kind of sort of fine, you will do that until you're faced with a crisis or a big crossroads. And then you're going to have to jump into one of those other categories. But if we try on some of those other behaviors and other thoughts from some of those groups, you actually may be able to prevent some of the diseases that we're worried about in the general population, like heart disease, like mental health, like gynecological challenges, right? So thinking about our 3 categories, right? There were pros and cons of all of them, right? I love working with all of them. And sometimes y'all drive me crazy, because the way that you're thinking about your decisions in healthcare are in that one category. And there are many other ways of thinking about the way that you approach your health. And so if you saw yourself in one of those categories, it's a great question of well, what can I learn from my peers, my friends, right? My Pilates crazed people who will now no longer go to brunch because it doesn't fit into their eating schedule. Can I learn anything from them? Or is the health target that I have actually not in the category that I'm in? If you're like, oh, I know I'd like thriving health, please, but you're living in Gen Pop, then we have to be curious. If you want to pursue greatness, then we might have to create some space for it in your calendar. I hope you enjoyed that episode. I think it's a really neat way to think about health and health behavior and health decisions. And if you're a practitioner that's listening, like funnily, when I was thinking about this, naturopathic doctors are pretty much taught to focus on the people who've run out of options. And that always drove me crazy because there are so many more people in the other categories. First of all, just volume wise, we can have a way bigger impact if we help the general population make changes to their health. But we're often taught to focus on, well, this is the last resort. This is the last option. Or let's use this off-label medication, even though we have a totally great solution over here that we could do instead. We're taught to live in the weird and wonderful in health rather than thinking about the general population. The other thing that NDs will often do is live in the health hobbyist land and assume that everybody wants to be there, right? When a Gen Pop shows up and we're going to have a hard time getting this person to do fiber, but the plan that's given is as if they're a health hobbyist, right? And it's like, okay, as of now, you are transformed into someone who really, really cares about all this and has 18 hours a week to meal prep. We assume that the person is in that health hobbyist land when they're actually just looking for some pretty quick fixes to support their health journey. So it's important, depending on where you are, but that you also get matched up with a practitioner that understands where you are and understands what you're hoping to get out of your healthcare. And if you're in Gen Pop and you're going to go see a naturopath, I would be super clear about that and be like, all I need is for you to tell me 2 or 3 things I can do here to support my health. I cannot, nor do I wish to, make this my hobby. And I think your appointments will go so much better because you both are going to get on the same page quite fast, and you're not going to leave your appointment with a 15-page document and all the stuff you're going to do now. So if you're a practitioner listening, I think it's an important place to think about what your patients' values are and where they live across that spectrum, and then meeting them where they're at with the solutions and helping them maybe see, what maybe their hopeful next step might be in their health. But meeting them where they're at, I think, is going to give you all the best outcome with respect to your appointments. We'll see you guys next week.
That's it for today's episode of the Real Integrative Medicine Podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine Podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.